Assalamu alaikum everyone. Today we are going to talk about another very short topic in the gallbladder and biliary tract disorders, that is cholangitis. So what is cholangitis? It is an infection of biliary tract secondary to the obstruction in the biliary tract. It is the medical emergency and a life-threatening condition. So come to the causes of cholangitis. The most important and the common cause of cholangitis is choledocolithiasis, that is stones in the common bile duct. Due to stones accumulation in the common bile duct, there is a bacterial overgrowth in the backward direction in the common bile duct as well as in the cystic duct and the whole biliary tract. So it causes the cholangitis, that is infection in the biliary tract. And the other very rare causes are stricture formation in the biliary tract after surgeries and tumors of the biliary tract which is compressing the common bile duct and after ERCP procedures. So choledocolithiasis is common and the other causes are rare. Now come to the clinical features of cholangitis. Patient has features of the obstructive jaundice, that is the patient has cholestatic features. Patient has jaundice. Fever may or may not be associated with rigors because fever is because of infection, and patient may have right upper quadrant pain. So these three features are very important and these are called Charcot's triad. Now come to the investigations. In the liver function test, patient gives a picture of cholestasis, that is alkaline phosphatase levels are high, gamma GT levels are also elevated, and mild elevation in the transaminases along with increased direct bilirubin levels, that is patient has direct hyperbilirubinemia. And in the CBC, that is complete blood picture, patient has increased WBC count, that is leukocytosis because of infection in the biliary tract. And ultrasound is the initial investigation, but it is less sensitive. It is more important for the problems in the gallbladder. So ultrasound is less sensitive investigation, and ERCP is the gold standard investigation for the diagnosis of the choledocolithiasis or stones, because these stones are responsible for this cholangitis or infection in the biliary tract. So it is a gold standard investigation or in the investigation of choice for the biliary stones. Now come to the management. In mostly initial management is conservative. Give the patient, try to relieve the symptoms of the patient. Give the patient analgesics like NSAIDs or opioids in severe pain, and give the patients IV fluids like normal saline or ringer lactate and IV antibiotics like metronidazole in some cases, while the most commonly used drug is cefirexime, which is third generation cephalosporin and commonly used drug in case of cholangitis. Now come to the most important step. When the patient got stable after the conservative management, then perform the ERCP. Remember, do not perform the ERCP during the acute phase of the cholangitis because of the severe extensive inflammation in the biliary tract. So after the settlement or after the patient got stable, then perform the ERCP, that is endoscopic retrograde cholangiopancreatogram. It is diagnostic as well as therapeutic. As we have discussed, it is gold standard investigation for the stones in the biliary tract, as well as it is most important for therapeutic purpose as well. So ERCP along with sphincterotomy is the treatment of choice to remove the stones, because the stones are the actual cause of this cholangitis. So if we remove the underlying cause, then automatically cholangitis will be settled down or it will be. But if ERCP fails, then the other procedures are percutaneous transhepatic catheter drainage, that is removal of the pus and the infective material through the approach through the skin, in which the catheter is inserted through the skin and the whole pus and the other infective material is removed. So this is PTC. And the other options which are very rare nowadays, that is T tube insertion, in which the T shaped tube is inserted to remove the pus and drain the pus. So this was whole about the cholangitis. Thank you so much for watching this video.